I see patients for a variety of gynecologic disorders that are symptomatic, such as big fibroids, endometriosis, but especially cancers of the gynecologic organs, ovarian cancer, uterine cancer, cervical cancer, things like that. The cancers that we see often present with a variety of symptoms, some of which are very nonspecific. Ovarian cancer, for example, people generally present with abdominal distension or bloating, really symptoms that kind of mimic a variety of other conditions as well, so there's really no clear sign or symptoms associated with it. So it's important that people are open to the potential symptoms, that they're kind of aware of their body, and go in to see their doctor if anything seems out of the ordinary. Other types of problems include vaginal bleeding, especially menopausal bleeding, or pelvic pain. Surgery is needed for our patients depending on how symptomatic they are, and in general, cancer of the gynecologic organs is treated primarily with surgery, either hysterectomy for removal of the cancerous uterus, a debulking procedure to get rid of any cancer that might be visible in the abdominal cavity. So most gynecologic cancers are treated primarily, at least initially, with surgery, and often that's followed up with other forms of therapy such as chemotherapy or radiation. The goals of treatment of any condition really are primarily to relieve symptoms, and in the case of cancer, to cure the patient of their disease. So that's our primary objective. We try to approach every case that way, that the ultimate goal is to cure them of their cancer, and I think that goes a long way in terms of developing a close working relationship with the patient. The recovery really varies on the type of the procedure and the condition that we're treating. In some cases, the recovery can be 6 weeks or longer, depending on the operation. But now, more and more, the majority of gynecologic cancers are treated through a minimally invasive surgical approach, where their stay in the hospital is much shorter and the recovery period is much less, generally 2 weeks, where they can get back to work, get back to their families, get back to their usual activities.